So friends, today we are going to understand rotator cuff tears. Now, patient with shoulder pain usually thinks the pain is because of frozen shoulder, but many a times it may not be so. It might be a rotator cuff tear. So let's understand what is rotator cuff tear. So to understand what a rotator cuff tears, let's understand first the shoulder anatomy. So shoulder, as you know, has a socket and there is a ball, and these articulate perfectly. And rotator cuff is this tiny muscle which holds the shoulder in place. And over that, you have this big muscle which is the deltoid muscle. So for the deltoid to act, the rotator cuff muscle has to be intact. And this holds the shoulder in place so that the other big muscles can work. If you get a tear here, usually you get tear here where it is inserted on the head of humerus, you can get pain when the patient tries to do this, and the shoulder will wobble, and that is the reason the rotator cuff is so very important in the shoulder biomechanics. So there are many causes, but the foremost cause is acute injury, like a person falling gets a muscle tear. That is the commonest cause. Other causes are overuse, like a weight training beyond a particular point. If the athlete lifts up a heavy weight, then this weight can cause rotator cuff tear. And some athletes are on steroids, and that causes muscle weakness and leading to rotator cuff tear. So that is number two cause of rotator cuff tear. So in the last 20 years in which I am treating shoulder injuries, I am finding that these athletes who are into heavy duty weight lifting, they are the number one prone candidates for rotator cuff tears. When you are in the heat of weight training, you don't realize how much weight you are really lifting. And if excess weight is lifted, they can really tear your rotator cuff. Number two, patients who are prone for this rotator cuff are old patients whose muscle has sort of atrophied over the age because of age, and when they do daily activities like even lifting of bucket, they can land up with a rotator cuff tear. So these are the two broad categories whom I am seeing over the last 20 years having this particular condition. So there are three main symptoms which the patient presents us with. The number one is pain, and the pain is really unrelenting, interfering with the sleep, and all movements, especially the upward movements, overhead activities become very painful. Number two is visible muscle atrophy. The muscle really shrinks because it is having pain and the movement is less. And number three is weakness. The weakness is really pronounced while doing movements, and all movements which the patient used to do very easily previously are not possible because of the muscle weakness. So, treatment has really evolved in a rotator cuff tear. If it is a very early rotator cuff tear, patient presents at the earliest sign, then treatment is usually conservative with medications to improve the healing of the rotator cuff, physiotherapy, a few exercises. All this can heal a early rotator cuff tear. But the patient who has presented late in the onset with a large rotator cuff tear, those patients are not amenable to conservative line of treatment. So these patients usually require shoulder arthroscopy, which we do regularly. And what we do in this is through two tiny keyholes, we repair the entire rotator cuff. And with that, the patient can do all the activities after a good amount of exercise and rehab. My take home message is don't neglect shoulder pains. Not all shoulder pains are frozen shoulder. They can be rotator cuff tears. And if you present early, the results can be very good. And always remember, a stitch in time saves nine. So keep that in mind and always keep health as your first priority.